In honor of Father's Day, I want to drop the 6 essential health exam that every man needs. So let's start off with a checklist for all the men in their 20s and 30s. We have the primary care visit once a year, to get screened or tested if needed, and to build a relationship with a doctor you trust. Blood test screening once a year, to allow the physician to assess the risk for conditions such as diabetes, kidney disorders, and heart disease. And also run a urine test for kidney disorders, liver problems, and diabetes. Moving on to the checklist for all the men in their 40s and 50s. You have primary care visits at least once a year or as often as needed. Routine blood test screening at least once a year or as often as needed. Colonoscopy to check for colon cancer. They recommend starting at the age 45 or older or earlier if you have a family history of colon cancer. And for all those without family history of colon cancer, they generally recommend you get a colonoscopy every 10 years after your initial visit. Also, a PSA, prostate-specific antigen blood test, once a year or starting at the age of 55 or earlier if you have a family history of prostate cancer. A skin cancer screening once a year, a cardiology screening once a year, or as needed, especially if you have a family history of heart disease. Moving on to the men 60 and older. You have primary care visit at least once a year or often as needed. Routine blood test screening at least once a year or often as needed. Colonoscopy, prostate exam, or a PSA blood test once a year. Skin cancer screening once a year, and a cardiology screening once a year. And while you're at it, you're going to get an STD screening, check for hepatitis B, a cholesterol and high blood pressure screening, a bone density test, a hearing and vision screening, oral health care checkup, and that's all I have for you at the moment. You do as you please with this little bit of information. Y'all take care of yourself and stay on top of your health. Have a blessed day.